I'm going to be presenting on Section M of the LTCH CARE Data Set, which has to do with skin conditions and skin integrity. So Section M, as I said, deals with the skin conditions, specifically pressure ulcers. The objectives of this section are to define the section itself, which I have, explain the new items or changes between the LTCH CARE Data Set version 2.01, which is currently in use by LTCHs, and version 3.0, which will be effective as of April 1st, 2016. And we'll be discussing coding instructions and needed informations for different items, and then going through several scenarios together. So some of the changes to Section M for the version 3.0 of the LTCH CARE Data Set, the present on admission item, which is labeled M0300B2 through M0300G2, those items have been removed from the admission assessment. And for those of you who have been working with the LTCH CARE Data Set for some time, you may have noticed this already in looking at the LTCH CARE Data Set. Previously, there were two indicators under the M0300 items. The first, which asks you to indicate a number of pressure ulcers or the current count of pressure ulcers that were present, and the second asks for you to indicate the number of pressure ulcers that were present on admission. CMS, in looking at this and trying to cut out any burden that is unnecessary, it's standard clinical practice to conduct a skin assessment as soon as possible, or as close to admission as possible. And because of that, we look at any pressure ulcers that are coded on the admission LTCH CARE Data Set as present on admission. These pressure ulcers should be recorded from the very first skin assessment that's performed on the patient, and adding a present on admission indicator was a little redundant, we felt. So we removed those items from the admission item set. Additionally, we added new items. We added M0800 items to the planned and unplanned discharge assessments, and those items have to do with unstageable pressure ulcers, which are unstageable due to either non-removable dressings, slough or eschar, that's covered the wound bed, or suspected deep tissue injury. The intent of this section is to document the presence, appearance, and change of pressure ulcers. And there are a few overarching principles that we need to remember throughout this section. The first is that the pressure ulcer staging definition used throughout Section M were adapted from the 2007 version of the National Pressure Ulcer Advisory Panel staging definitions. If you're familiar with the most common, or the most current rather, definitions, you will see some slight differences. The important thing is to remember that in order to code the LTCH CARE Data Set, you're going to need to use the definitions that are included in the LTCH QR Program Manual. Secondly, even though the LTCH CARE Data Set captures the status of pressure ulcers on admission and discharge, completion of this section does not preclude the LTCH from providing a comprehensive and ongoing assessment of the patient's skin throughout the LTCH CARE stay. And third, it is important not only to identify and evaluate a patient's risk for developing pressure ulcers, but when skin integrity issues are identified, to determine the etiology of any and all skin ulcers, wounds, and lesions. Not only are you able to ensure that appropriate treatment or interventions are initiated, but this also allows for accurate coding of the wound. So we're looking here at the new version 3.0 M0300 item. And as you can see, it's capturing the current number of unhealed pressure ulcers on admission at each stage, and it's all under one item. And so the M0300A1 through M0300G1 items are completed only if A0250 is equal to either admission, planned, or unplanned discharge. So that's 1, 10, or 11 for the codes. We do not collect this on expired assessments. It asks you to enter the number of pressure ulcers that are currently present and to enter 0 if there are no pressure ulcers present. Also, the M0300A1 to G1 items, they're also found on the discharge assessment, both planned and unplanned. I just went over these for the admission assessment. On the discharge assessment, these items collect the current number of pressure ulcers on discharge. Okay, so this is what the discharge assessment looks like for the M0300 items. And you'll notice that there are 2 items included under each stage, each pressure ulcer stage under this item. So they ask not only the number of unhealed pressure ulcers at each stage, but which of those pressure ulcers identified in the first item were present on admission. So, and those are the M0300B2 through G2 items that ask about present on admission status. The instructions for these guide you to code the current number of unhealed pressure ulcers present on discharge that were also present on admission to the LTCH. Again, you'd be entering 0 if no pressure ulcers were noted at the time of admission. All right, so now we're going to go through a few coding scenarios. The first of which, a patient arrives at the LTCH on day 1. A clinical assessment is completed on admission with no pressure ulcers identified. On day 3, while bathing the patient, a stage 2 pressure ulcer was noted on the patient's sacrum and documented in the patient's medical record. The patient was discharged with a stage 2 pressure ulcer 8 days later. So, okay, first I should say, in order to participate in these exercises, you'll probably need your cards 0 through 3. I don't think you'll need any more than that. In reference to this scenario, how would you code M0300 on the admission and discharge assessment? So I'll ask how you would code this for M0300B1, the number of stage 2 pressure ulcers on the admission assessment. I see lots of zeros, some ones. The answer is 0, that's correct. And how would you code M0300B1 on the discharge assessment? These several ones, and that's correct. 1 is the answer. Moving on to M0300B2, which asks the number of these stage 2 pressure ulcers present on admission. How would you code that on the discharge assessment? Anybody? All right. It would be coded as 0 on the discharge assessment, and I'll go over some of the logic here. Here's the answers here. And so when we're thinking about this, even though the patient had a pressure ulcer identified on day 3 of the LTCH stay, only those pressure ulcers that were present as close to the time of admission are coded on the admission assessment. So only those pressure ulcers that are identified through the initial skin assessment, which is supposed to be done as close to the time of admission as possible, are identified on the admission assessment. So the answer to M0300B1 on the admission assessment is 0. On day 3, this patient did develop a pressure ulcer, a stage 2 pressure ulcer. And so when we're moving to the discharge assessment, M0300B1 would be coded as 1, which many of you got correct. And then M0300B2 would be coded as 0 on the discharge assessment. And so the logic behind this, and I think a lot of confusion happens at this point in the LTCH CARE data set. When this question is asked about how many of these were present on admission, that statement itself, when it says how many of these pressure ulcers were present on admission, it's referring to the first part of the question. So if you're identifying a stage 2 pressure ulcer for M0300B1, and you only identify one, it wants to know, the second question, what it's asking is how many of the stage 2 pressure ulcers you identified in the first part of the question were actually present on admission. And so for this scenario, it would be 0 because that stage 2 pressure ulcer was not present on admission when the initial skin assessment should have been performed. Okay, moving on to the second coding scenario. On admission, the patient has 3 small stage 2 pressure ulcers on her coccyx. 3 weeks later, upon discharge, the coccyx is assessed. 2 of the stage 2 pressure ulcers have merged. The third ulcer has increased in numerical staging to a stage 3 pressure ulcer. How would you code M0300 on the admission assessment and discharge assessments? So for this scenario, how would you code M0300B1, which is the number of stage 2 pressure ulcers, on the admission assessment? See, lots of 3s, and that's absolutely correct. M0300B1 on the discharge assessment, which asks how many stage 2 pressure ulcers were present at discharge. Anybody want to try that one? I see some 1s, and that is absolutely correct. And of those stage 2 pressure ulcers, how many were present on admission? 1, I see a 1, and that is the correct answer. 1 of them was present on admission. How many stage 3 pressure ulcers were present at discharge? 1, exactly, very good. And then lastly, of those stage 3 pressure ulcers, how many were present on admission? And I see 0, yes, that answer is 0. So there's the answers there. And so, here's the logic behind this. There were 3 stage 2 pressure ulcers that were present on admission to the LTCH, and the patient's admission to the LTCH. But prior to the discharge, 2 of those stage 2 pressure ulcers merged to create 1 stage 2 pressure ulcer. And the third stage 2 pressure ulcer that was identified on admission developed a deeper level of tissue damage and became a stage 3 pressure ulcer. So for M0300B1 on the admission assessment, it was coded as 3. There were 3 stage 2 pressure ulcers on admission for this patient. Moving to the discharge, M0300B1, which asks the number of stage 2 pressure ulcers that were present on discharge, would be coded as 1 because 2 of this pressure ulcers that this patient had merged to form 1 pressure ulcer, and then the third pressure ulcer advanced to a stage 3 pressure ulcer. So that only left 1 stage 2 pressure ulcer on discharge. Then M0300C1 is coded as 1 because, as I said, the third stage 2 pressure ulcer developed a deeper level of tissue damage and became a stage 3 pressure ulcer. And then lastly, M0300C2, which asks of these stage 3 pressure ulcers, how many were present on admission? And the answer to that was 0. There were no stage 3 pressure ulcers present on admission for this particular patient. Correct. Correct. Okay, moving on to another scenario. A patient enters the LTCH with a stage 2 pressure ulcer. On day 2 of the patient's stay, the wound is reassessed at a stage 3 pressure ulcer, and then the wound does not heal by the time of discharge 2 weeks later. So the patient entered the LTCH with a stage 2 pressure ulcer. On the second day, the wound was reassessed as a stage 3 pressure ulcer. The wound does not heal by the time of discharge 2 weeks later. How would you code the M0300 on the admission and discharge assessments? So for M0300B1, which is the number of stage 2 pressure ulcers on the admission assessment, how would you code that? As a 1, exactly, very good. M0300B1 on the discharge assessment, asking how many stage 2 pressure ulcers on discharge. 0, very good. M0300B2, asking the number of these stage 2 pressure ulcers that were present on admission. 0, very good. I'm sorry, what's your question? Well, I'm talking about the discharge assessment, so, okay, yeah, I see what you're saying. You would skip that. For the purposes of this exercise, I was just demonstrating that that is 0, but you're right. If you answered 0, there would be no reason to answer the second part of the question because the B1 question was 0. That's exactly correct. Then M0300C1 on the discharge assessment, which asks how many stage 3 pressure ulcers were present at discharge. Anybody? I see 1s here. That is absolutely correct. And then lastly, how many of those stage 3 pressure ulcers were present at discharge? And I see lots of 0s, which is correct. So here are the answers here. I think this one's pretty simple. The stage 2 pressure ulcer that was present on admission, even though the wound worsened during the 3-day assessment period, the initial stage of the pressure ulcer was captured during the patient's skin assessment, which should happen as close to the admission as possible. And once that happens, any worsening or additional pressure ulcers that developed will not be captured on the admission assessment. So M0300B1 on the admission assessment was coded as 1 because the initial stage pressure ulcer, or the initial pressure ulcer was a stage 2 at admission. M0300B1 and 2 were both coded as 0 on the discharge assessment, or M0300B1 was 0 and the second part got skipped. M0300C1 was coded as 1 because the stage 2 pressure ulcer developed deeper tissue injury during the LTCH day and was a stage 3 at the time of discharge. And M0300C2 was coded 0 because that stage 3 pressure ulcer was not present on admission. All right, now we're going to move on to the M0800 items, which are worsening in pressure ulcer status since admission. This is a snapshot of the item from the LTCH CARE Data Set version 3.0, and this item specifically asks you to indicate the number of current pressure ulcers that were not present or were at a lesser stage on admission, and if no current pressure ulcer at any of the given stages, you would enter 0. So that's really important to emphasize here, that this is not only those pressure ulcers that were at a lesser stage at admission, but any pressure ulcers that were not at admission at all and that are considered new. So coding instructions for this item, these have also been updated and now guide you to compare the number and status of each current stage 2 to 4 pressure ulcer, as well as unstageable pressure ulcers on the admission assessment, with the number and status of stage 2 to 4 stageable or unstageable pressure ulcers present on discharge, to determine those that were not present, that were actually new, or those that have worsened since admission. So again, we would enter the number of stage 2 to 4 or unstageable pressure ulcers that were not present or that were at a lesser stage, and we would enter 0 if there were no current stage 2 to 4 or unstageable pressure ulcers at discharge. So we're going to move on to a scenario for this item, the M0800 item. A patient is admitted to the LTCH with a stage 2 pressure ulcer. The ulcer developed a deeper level of tissue damage exposing muscle and is staged as a stage 3 pressure ulcer during the stay. The wound bed subsequently covers with slough and is identified as an unstageable pressure ulcer. The patient discussed his discharge plan with the LTCH and decided to go home with home health services and receive wound treatment at a local wound care clinic. On discharge, the patient record notes that the wound debridement was not performed on the stage 3 pressure ulcer at the LTCH and would be performed at the wound clinic. So the last sentence here says the debridement was not performed on the stage 3 pressure ulcer. It should actually say on the unstageable pressure ulcer. And so for this scenario, I'm going to ask how you would code the M0800 on the admission and discharge, and I'll prompt each of these. So for the M0300B1, the number of stage 2 pressure ulcers, on the admission assessment, how would you code that? Lots of ones, and that is absolutely correct. M0300B2 on discharge, on the discharge assessment, is 0. I see a few zeros out there, and that's absolutely correct. The M0300F1, which is the number of unstageable pressure ulcers due to coverage of a wound bed by slough and or eschar, how would you answer that on discharge? I see a 1 here. Very good, very good. And M0300F2, which asks the number of these unstageable pressure ulcers that were present upon admission. So it's referencing the F1 question, and the answer is 0. Very good. So moving on to the M0800, for this coding scenario, the M0800A, worsening in pressure ulcer status since admission for stage 2s, how would you code that? I see a 0, and that's very good. It would be coded as 0. M0800B, which asks about worsened pressure ulcer status for stage 3 pressure ulcers on discharge. Zeros, very good. The answer is 0. Stage 4 pressure ulcers for M0800C, 0, very good. M0800D, which asks about worsening in pressure ulcer status since admission for unstageable, non-removable dressings. And that's coded as 0. I see several zeros up. M0800E, which asks about unstageable due to slough and or eschar. I see lots of 1s, very good. And M0800F, 800F, which is unstageable due to deep tissue injury. I see lots of zeros. Okay, so I want to talk a little bit about, I'm going to just back up a slide or two and talk a little bit about this because it's a little confusing in that I don't want anybody to feel like what we're doing here is calling an unstageable wound a worsened wound here. So I know that this particular item is titled M0800 Worsening in Pressure Ulcer Status Since Admission. The reason I pointed out sort of the subheading there that talks about the purpose of the question and asks you to indicate the number of current pressure ulcers that were not present or were at a lesser stage on admission. So it's asking you to identify any new pressure ulcers that were not present on admission or those that were at a lesser stage. So that's really important. I know it seems like in looking at this, we could be sort of dinging you for a better, for lack of a better term, or this could, we could be looking at an unstageable pressure ulcer because of any of the three reasons there as a worsened ulcer, and that's not what we're doing here. So we have decided, or we're in discussions to clarify this item. So more to come on that, but I just want everybody to know that we are aware, and it's certainly not our intent to classify an unstageable wound as a worsened wound, because you certainly don't know if that wound has worsened or not until it's no longer unstageable. All right. All right, we're going to move on to this coding scenario. A patient was admitted to the LTCH from the acute care hospital with a stage 2 pressure ulcer blister on the left heel, which ruptured and presented as a shallow ulcer with a pink wound bed. On the 4th day, the right heel was noted to have a blood-filled blister, and by day 6, the surrounding area of the right heel blood blister, was boggy, painful, and warm to the touch. After discussion with the family and approval by the patient, they decided to care for the patient at home with home care services and asked to be discharged from the LTCH against medical advice. So for this scenario, I'm going to ask how you would code the M0800 items. So for M0800A, worsening and pressure ulcer status since admission for stage 2 pressure ulcers, how would you code that for this scenario? Anybody? 0. Okay, I see a 0. Thank you. 0 is the correct answer. For M0800B, which asks about worsening and pressure ulcer status since admission for stage 3 pressure ulcers, how would you code that? I see a 0 and a 0. Very good. Several zeros. Great. You guys are doing great at this. M0800C, which asks about worsening and pressure ulcer status for stage 4 pressure ulcers. 0, 0. Very good. And then how about M0800F, which asks about worsening and pressure ulcer status since admission for unstageables due to deep tissue injury? See a 1. Okay, that would be coded as 1. Here's the answers here. And we'll go over the rationale here. So the initial assessment identified one stage 2 pressure ulcer on the patient's left heel, which was present on admission. And the ulcer remained at a stage 2 until discharge, that left heel pressure ulcer. The patient also developed a suspected deep tissue injury on the right heel prior to discharge. Therefore, the M0300B1 was coded as 1 because the initial assessment identified the stage 2 pressure ulcer as present on admission. For the discharge assessment, M0300B1 and B2 were coded as 1 because the stage 2 pressure ulcer did not evolve and remained a stage 2 pressure ulcer at discharge. M0300G1 and M0300G1 is coded as 1, and M0300G2 is coded as 0 on the discharge assessment because the SDTI, or suspected deep tissue injury, developed during the LTCH stay. Also, the M0800F is coded as 1 on the discharge assessment because the SDTI was new. I think one more scenario here for M0800. Okay, for this one, a patient is admitted with a non-healing stage 3 pressure ulcer on the left trochanter. The patient's physician ordered negative pressure wound therapy with the dressing to be changed 2 times per week on Wednesdays and Saturdays. The negative pressure wound therapy dressing was applied on Wednesday, but prior to the next dressing change, the patient was unexpectedly discharged to the acute care hospital for an unrelated condition. So how would you code M0800 on the discharge assessment for this particular scenario? So M0800 A, which asks about stage 2 pressure ulcers on discharge, 0, 0, very good. M0800B, which asks about stage 3 pressure ulcers, very good, 0. M0800C, which asks about worsening in pressure ulcer status since admission for stage 4 pressure ulcers, 0s, I see, very good. M0800D, which asks about worsening in pressure ulcer status since admission, unstageable due to a non-removable dressing. I see a 1 there, and that is the correct answer. Very good. M0800E, which asks about worsening in pressure ulcer status since admission for unstageable wounds due to slough or eschar. That would be coded as 0. Very good. And then lastly, the M0800F, which asks about suspected deep tissue injury, that would be coded as 0 as well. And talk a little bit about the rationale. The stage 3 pressure ulcer that was present on admission, and the patient was discharged unexpectedly with the negative pressure wound therapy dressing intact. Therefore, M0300C1 was coded as 1 on the admission assessment. M0300C1 and C2 should have been coded as 0 on the discharge assessment. And that's asking about stage 3 wounds that were present at discharge, and of those wounds, which ones were present at admission. The answer is 0 for both of those. And then M0800D is coded as 1 on the discharge due to the presence of the non-removable dressing. So to summarize this presentation, Section M documents the presence, appearance, and change of pressure ulcers. You should keep the overarching principles I reviewed in mind when completing Section M. M0300B2 through the M0300G2 items have been removed from the admission assessment. So those present on admission items have been removed from the admission assessment, but have been retained on the discharge assessment. And then new items were added to the discharge assessment, which are the M0800 items. And those have been added to both the planned and unplanned discharge assessments. So the action plan, revise any processes to ensure tracking of all pressure ulcers and changes in pressure ulcer status in the patient record. I think it's important to maybe review the way you're currently maybe capturing pressure ulcers with that present on admission, the M0300 B2 through G2 items that are currently on the LTCH CARE Data Set version 2.01 compared to how those same pressure ulcers will be captured on the new version of the LTCH CARE Data Set as of April 1st, 2016. Be sure to add unstageable pressure ulcers to your tracking of new and or worsened pressure ulcers, and certainly practice coding a variety of scenarios with your staff. And that's all I have.